pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Need to do the approval for the minutes.
I'll second it.
Second. All those in favor?
Yeah.
Aye. Move on to resolutions. We're going to authorize a budgetary modification for Department of Social Services and service and daycare. Do you want to speak to this, Marty, or do you want to do it?
Service daycare.
But this is basically to accept funding, isn't it, for this?
Increase in integrated community planning is their contract law? Yeah, I'm sorry. That's okay. Yes, this is an increase to the amount for ITP. Integrated community planning is our organization that we contract with to our daycare verification, not eligibility, but
Right.
they coordinate with daycare providers in the community, and they do registration and inspection services. Their contract has been the same amount for a very long time. So this year, we increased a little bit. It's above the application for it. All state funds, no local district.
Right, this is all state funding. Do I hear any motions?
Yeah.
Second? Motion second. All those in favor?
Aye.
HS2, resolution authorizing budget modification for Department of Social Services to accept the federal Child Abuse Prevention and Treatment Act funds and the Apprehensive Addiction and Recovery Act funds, SFY 023. Have a motion? All right, this funding is also 100%, this is federal funding. Money coming in. Anyone care to speak to this?
Well, it's monies for us to contract with Huntington Family Center for a specialist within addictions within our welfare practice.
Where is the Huntington Family Center?
It's located in Fulton in the Catholic Charities complex there. Head Start's in there, Oswego, and Huntington is in there.
All right. All those in favor? Okay, HS3, resolution awarding professional service contract RFP 24 DSS 001 case management assistant. This one is there is some questions that I have on this, and it's more with how we arrived at who was chosen, because there was actually two bidders on this, and the higher bid was accepted and the lower bid wasn't. Can you have anyone speak to that? I mean, we have the pros and cons, we're just trying to understand that a little bit more.
Would you like to speak to this?
Yep, so I reviewed both of the contracts that came in. This project used to be two separate contracts for the agency, that since the employment services has come under me, we've combined them into one. The proposal that Salvation Army submitted only allowed for 2 caseworkers to manage the capacity of 80, which we had put out in our proposal, and the submitted proposal from OCO has 2 senior caseworkers, 2 case managers, and a peer advocate. So that would justify the difference in costs. The intensive case management we're seeing now with our homeless population, the project will focus on helping them get to an employment status so we can move them off of services. and 2 case managers would not be able to handle that capacity with the needs of this population.
Now, they said that the Oswego County Opportunity said they had 70% of the staff identified. Is that included in that number you're talking about?
That's because the previous 2 contracts, they already had 2 case managers assigned and the supervision. So now they're bringing on 2 more senior case managers and a peer advocate under the combined contract.
All right, but they haven't been chosen yet, is what they're saying?
Not the additional ones, no. The other ones are from the previous CMA contract that has already been approved and expires at the end of this month.
Will they be internal people that will just move over into that, or how will they do that?
Internal from OCO?
Yeah.
I'm assuming so. I mean, it's not internal from our agency.
Like we're having trouble with caseworkers, they wouldn't necessarily have to go outside to fill those and run into the same problem.
Yeah, we kind of use titles across agencies the same, but the case managers at OCO are not the same level that our caseworkers are at DSF.
Okay.
They're more housing specialists. They focus on day-to-day helping with barriers such as transportation, childcare, substance use disorders, so they can provide a little more one-on-one to these households that we can't provide as eligibility workers at the agency.
Okay. That helps answer the supply. Anybody else? Can I get a motion? First and second? All those in favor?
Aye.
Okay. Thank you for that information.
You're welcome.
Okay, that ends that portion of our meeting. Well, I guess we can, there's no committee review and discussions. We don't have any on the agenda, so I'll move to department reporting and social services.
So, we did send out, the department's annual report. I don't know if everybody's had the opportunity to review it or not. But I just want to walk through and give you a few of the highlights, to look at. 2023 was a pretty good year for us, and it created a lot of change. So one thing being with caseworker positions being increased in salary made a huge difference for us as far as recruitment, as well as the health program. So now several different positions. I think we have 5 or 6 different positions within our department that can be hired without a civil service exam ever needing to happen, which is wonderful. Caseworker being one of them really helped us with our recruitment efforts in that area. So we were able to bring on over 100 new staff in 2023, and we had over 40 new promotions during the year as well. Lots of change. A lot of our units are still very inexperienced. So, for example, our services unit, 63% of our caseworkers have less than 2 years experience. So that's going to take some time for us to be able to develop their expertise and continue training, maintain a level of staffing that is helpful and good for us. And Sarah's going to talk a lot more about the services side of the house as well. But that was a significant change for us. Social welfare examiners, unfortunately, haven't had as good luck. They are also included underneath the health program. And we went from 22.2% vacancy at the beginning of the year down to as low as 13%. But by the end of the year, we were back at 22.2 again.
Mm-hmm.
So that position is particularly difficult. There's a lot of program regulations and rules and exceptions and laws that you have to know in order to be able to pull it off successfully. And our population is presenting with a lot more complex issues than they ever have in the past. Our application rates are up tremendously. Our caseloads, the number of people qualifying not as much. So that's relatively stable. For the safety net population, the active caseload has dropped off a little bit, but that's largely due to non-compliance, not the inability to follow through with things. A lot of homelessness. We had over 1,100 people present as homeless in 2023 as compared to about 934. Excuse me. Medicaid applications are up considerably, but again, the caseload is remaining stable. With the cost of things going up and up, people are reaching out to apply, but are not eligible due to income.
How quick do they find that out during the process? Fairly quickly, or do they go through quite far down the road before they find out?
For all of our programs?
Yeah.
So state regulation requires that we do it within 30 days. Unfortunately, because of staffing, we haven't done that lately. But I would say probably 60 to 90 days, most households are finding out.
So with social welfare examiners coming on board, we try to hire them in groups. Until they've been on the job for a full year, 100% of their cases have to be reviewed for accuracy. And that puts a tremendous strain on the supervisors that are there for that. So we're really hopeful that our new window project that we put through last month is going to help relieve some of the task-oriented questions. It's going to relieve some of the pressures around our call center so that those CSWs might be able to better support examiners in their jobs and be able to free up supervisors by providing the easy access to training-related questions being answered. Then the supervisors can really focus on training them more holistically, helping people see the bigger picture across all programs and eligibility. We have some other ideas to help assist with that we'll be presenting next month as well. As far as Medicaid goes, we had to start redetermining eligibility for enrollees in April of 2023 as part of the unwind after COVID. So during COVID, people were just perpetually renewed on Medicaid. So the workload that comes from that is pretty high workload. And new applications continue to come in because of the cost of healthcare. But as a point of reference, the number of Oswego children and adults that are enrolled either through the exchange, which happens at the state level, or through us, is 41,101 people, Oswego County residents. So about 35% of our, thank you, 35% of our residents are actively enrolled in Medicaid.
Wow.
So that's very significant. Safety net cases have decreased over the last 5 years. However, the homelessness population has continued to increase. The cost for safety net cases is big because of the shelter expenses. And there's a huge majority of them that are presenting with mental health, substance abuse, chronic medical needs that need to be taken care of as well. So it's a very unstable population that we're working with. SNAP.
Before we move on to SNAP, I just want to say, given that jobs are plentiful right now, I just want to point out our financial assistance, so that's families with children who receive cash assistance. 100% of that is federal money as far as the actual benefits provided. And there's been a decrease of 30% in the last 5 years. That's significant. And then under safety net, there's actually been a decrease of 14.8% over the last 5 years. We didn't realize as big a jump for a decrease because once they time out, federal benefits only go for 60 months. Once they time out, they go back to a safety net. So that safety net is costing us more and is not decreasing as quickly as we would like to see. We have seen a decrease in the singles and childless couples, but there's a significant number. Do you have anything further, Gidget? I mean, this is really, you have the expertise here.
I don't have the numbers. I mean, it's something I could, but we do monthly. I see anywhere from 10 to 15 families clock out because this federal time limit started during Aurora times. So, I mean, it's been around a long time. So some of these families that are really hard to serve with children, which makes it more difficult with the other barriers such as transportation and childcare, after that 5 years, they move over to our safety net funding.
Now, how does that get flagged for them? Do they know it going, do they know when it's coming to the end?
Everybody that's interviewed for assistance has provided rights, responsibilities, information about those time limits. Typically around 48 months, when they're coming up to recertify, the worker will again have another discussion with them about, or I'm sorry, 58, when it comes up to the 60-month time limit.
You say homeless, are you talking about people, just people that you're serving, or are you talking about the very large amount that we have seen in the city of Oswego? I mean, is that in that number statistically too, everybody that's out with the sign, and even if they're not, are they all coming out to see you guys?
No, not all of them.
Okay.
The number that is in our report are the people we're serving directly.
Okay.
So there's other people being served through partner agencies such as Catholic Charities, veterans, OCO, that we wouldn't capture because we're not putting them into our data system if we're not providing them a service or a payment.
They may well be accessing the warming center though, right?
Our warming centers go into our data system, yeah.
So the victory and stuff like that?
Yep.
Not the men's boarding house, but the warming center. Yep. Sorry about that.
I want to slow down. People usually have a lot of questions and kind of this myth about there's more and more people going on welfare, and that's not true. So I wanted to be clear on that data. Okay, SNAP.
And for SNAP, the application is going to be stable, 22, 23. The total caseload average per month is 9,106 SNAP cases every month. And the total value of the SNAP benefits that have been issued, all federal money, is $32,218,657 in food benefits that hopefully people are spending in this county, and not across the board. There's also in 2023, there was an increase in EBT card scams. So when people go to the grocery store and swipe their benefit card to pay for their food, some of their food stamps were being stolen with the card reader. So if they were able to prove that their benefits were stolen, they were eligible to get their benefits reissued to them.
Are they seeing, where would you see that, like at Walmart or?
Yeah.
Okay.
Or
Now,
little stores.
One of our largest ones was a small vendor up north who we had 2 or 3 that came through as having their benefits lost. So my investigators went out and actually found the skimming machine.
On their property?
they didn't know
Wow.
because they're done so quickly. They're very thin plastic overlays to your credit card readers. So, we had reached out to the owner and he's like, we're a small mom and pop, it can't be happening here. So we went out and took a look for him and shook the machine for him and it popped off, so.
What are the recourses for them? How do they trace it?
I mean, they have, the state has.
The state and federal government is doing a large investigation.
Some, but,
Is that who it gets reported to?
Mhm.
yeah, and then there's a whole big process if they want to apply to get their benefits restored, which is not easy, if you're an elder,
Right.
or someone who's disabled. But the vast majority of people on SNAP are the working poor.
What's the income level for that? Just out of curiosity.
Do you have a,
It's 130% of the federal poverty level. I wouldn't know the exact amount right now.
depending on your household size? Yeah, depends on your household size, your
Yeah.
utilities, all of that goes into it.
And then for childcare benefits, childcare subsidies, the income level for eligibility went up to 85% of the state income, which is really pretty high. The family share, so most people, when they apply, their income is looked at to see what percentage of their childcare costs the family has to pay for. All of those were reduced to 1% of income, of the income that exceeded the federal poverty levels. Okay, and then all counties were required by the state to pay for up to 80 absences every year per family.
What does that mean? So if they didn't go to daycare that day?
We
Okay.
still have to pay.
So-
Yeah, I think that's kind of across the board for any kid going to daycare.
Yes and no. I mean, 80 days, it's a lot of time.
Yeah, it is, but
Yeah. What was it? Do you remember? Pop quiz.
Well, districts used to have the option of having them choosing the amount. During COVID, we raised ours significantly because of kids not being able to return to daycare. So we were trying to keep providers whole, but this mandated districts to do 80. We used to do 26.
well,
Huge. Plus the increased income levels, we added a lot.
Yeah, and our allocation went up, but I'm not sure how sustainable this all is.
but do you feel most of the parents were then going to work though? They weren't just sending their kids to daycare because they're eligible? Right?
Well, that's, so most kids are in daycare because their parents are working.
Correct.
Right, okay.
There are some exceptions to that, looking for work, our own child protective cases.
Mhm.
So there are some exceptions, but the vast majority is parents are working.
Well, it's good that they're working though.
Yes.
They had
That's an expensive process. That's more than sending kids to private schools now. So,
So, HEAP, the Home Energy Assistance Program, is also federally funded. And in 2023, well, as of 2020, that's February 14th, 2024, we had issued over $40 million in HEAP benefits. So that's 100% federal funding, done in a lot of different ways with supplemental benefits, auto pays, emergency benefits, people who need heating equipment replacement and repair. All of those. I'm sorry. Is that your take over? Please.
Okay. HEAP is a very, very important piece here in the Northeast. So I know there has been kind of some speculation about who gets HEAP. Are they deserving? What I can tell you is, here in the Northeast, you'd be homeless if you don't have your heat. So 100% federal money for us to push into communities that are vulnerable is important. Into burials. So I was pleased to see that, over the past 5 years, the cost has kind of diminished. I assumed, maybe I'm wrong, that it's because more and more people are doing cremation.
Yeah, and we do see more of that than we do burials nowadays.
Yeah, I could agree.
Yeah. So you can see though, we're still exceeding $500,000, and we get very, very poor reimbursement from the state. It's a public health law. I always thought that all this money should be in the public health budget. Sorry, Dara. But it's also, as you can imagine, a very emotional time for a family who comes in to see us. And again, what's our reimbursement again? Like $900?
Federal is $900, for state is our percentage of the state, $900.
Employment services. So this is the piece that shifted away from Rachel Pierce, Workforce Development, new department, and shifted all the mandated activities surrounding employability to us. This was perfect timing for us because to integrate employability into all of Gidget's programs, that's very significant a leap and long overdue. Gidget, what would you like to say as you've taken this on for the past, 6-8 months?
Well, I really have to say that it has provided what I believe is opportunity, because historically our employment services were kind of bundled up with your WEO and more public-facing career services for our community, where the services for our mandated population just look and feel a lot different. They're obviously not doing it voluntarily, but this creates a nice bridge between the two, because my policy knowledge helps me work with the line staff to make it as effective as we can to get people to work. But also being connected and working with Rachel for as long as I did, I now have information and knowledge about programs she has that I can start to introduce to the population that are mandatory, so that we can start to move them in creative ways. I'm really trying to re-energize the employment services for our mandatory population. And I just think before, by having it split, it was difficult to see the middle road for them both. So I just think that by you guys doing that, it really gave us a good opportunity to have shared vision, but to, kind of incorporate them together to what makes sense.
Is there a lot of buy-in on the part of the folks?
We're getting there. Change is always different for people, and it's hard. But I have been present in that building the whole time, even when Rachel had to split her time between two, so that's a positive. They're familiar with me. They know my management style. It's just trying to get them all start to think of themselves as one team. Mm-hmm. Because I'm really trying to move towards a partnership where, whether it's eligibility or employment, we're working towards the same goal of moving people to a self-sufficient status. So I think we'll get there. It just always takes a little time. There's always some growing pains.
And I'll be frank with you. In Gidget's and her senior team's analysis of the duties assigned to employment specialists, who, by the way, are 2 grades higher than our social welfare examiners, there were many, many duties assigned to them that, frankly, typists, comp clerks, lower level community services workers could and should be doing. So there's a complete kind of reorganization, which we're promoting through this Burke study, and we have promoted right along that our social welfare examiners, child support examiners be raised 2 grades up to be equal to employment specialists. We retitled those 3 positions so that Gidget has the opportunity to shift people around where the needs are, or to decrease at some point when the integrated eligibility system, IES, is launched within the state. There is such great vision that we have to be able to be more efficient and provide a much higher level of service to folks who need these specialized efforts in order to get into the mainstream, which is very exciting. I think it's going to take us, though, Jay, it's going to take us another 2 years to really get everything kind of situated. Yeah.
Everybody seems to be okay with the process of,
Or retiring.
oh, well, let's hope that, but
But there is-
retirement's good, though.
There is plenty of opportunity to reduce the number of referrals back and forth and kind of consolidate duties so that I can do things myself that I used to have to send it to the paper now to get the,
Good,
to
very good.
kind of equalize that.
Okay, housing the homeless in Oswego County. Well, as Marty mentioned, you know, we had over 1,100 homeless citizens. 312 of them, or 310 of them were children. And that should be apparent to all of us as we've seen more substandard housing being pushed out of the market, people not being allowed to rent in substandard dwellings. The city has done a great job, you know, taking a look and getting some of those property owners accountable. But that also crowds out the housing for the poor. If you're on safety net assistance, roughly, you know, again, all kinds of formulas there, but about 190 a month or so you get for shelter costs. Where are you going with that? So the homeless population also looks different because, you know, as I reported out to the committee, the state has abdicated responsibility for people with chronic mental conditions or people with low IQ developmental disabilities. They literally just pushed away from the table and said, here, counties. When I was a caseworker, so I'm going back a few decades, it was a lot easier to get state housing, state-supported supportive housing for people who had chronic conditions. But not now, because the state really has just abdicated their responsibility. I speak loud and clear with other state commissioners and with my peers, other county commissioners, about this issue. And there will be continued very aggressive advocacy because this is happening all over the state. I mean, Gidget, when she meets with her peers, what are you hearing, Gidget?
Yeah, we have special focus groups now at all of our conferences to discuss homeless and housing in special populations. Because unfortunately, they struggle to be compliant with the rules that used to be required of them. But because of the state mandates, even if they are non-compliant, we still have to serve them. So where in the past, if they were non-compliant, we could stop providing that cash assistance housing, we can't anymore, which is creating a huge burden in every district across the state.
At the very bottom of page 12, where we identified some of those populations, I want to just tell you the importance of self-disclosed barriers to stable housing in 2023. So self-disclosed, 110 substance use disorder. Please know that is not accurate out of the 1,100 plus citizens. All of these would be higher numbers if they allowed us to put the data in after we had had experience with them and done all of the assessments. But this is the way the Federal Homeless Management Information System, HMIS, is set up for the initial intake based off the soils, what their barriers are. And that's where all this information comes from. Our fraud complaints, folks are usually pretty interested in what's going on with fraud. Gidget, do you want to speak a little bit to the turnover and what's happened in our fraud unit? Because it was, at one point I thought, do we even have a fraud unit?
Yeah.
What's going on here? Yeah.
Yeah, we saw a lot of turnover in our fraud investigative team during COVID, and there was a lot of standstill on what we could and could not pursue by the state. So obviously, for COVID reasons, they weren't allowed to go into homes, they weren't allowed to go out and see people, so there was a pause on a lot of the work. That senior members of the team retired during that time, and the principal over that team was promoted into our accounting team. So obviously different work, stayed within the agency, which is a positive. So our team now consists of a principal who had never done fraud before. She moved over from temporary assistance because they're both under me, so is now overseeing that, and the entire team is brand new. They've all been there less than a year, with the exception of our community service worker and one other investigator that's on the team. So they're coming back. We're starting to have, rebirth conversations with the DA's office about moving forward in prosecutions. Obviously, the turnover at the DA's office has had an impact on us because they've had very brief assignments of ADAs to help us with these cases. So some of our cases were sitting there for extended periods of time because they just couldn't get to them. So we're hopeful that, this year and going into next year, we're going to start to see a little more energy and ability within the team. It's difficult to do without the staff. There's supposed to be 2 SWEs in that team to help with the overpayments, but because of our short staffing on the eligibility side, I can't afford to put them there right now because of the timeliness requirements by the state and federal government. I don't want to put that at risk, so I have to kind of decide where I'm going to put my resources when I have them. So once we get full, we'll be able to move those SWEs back into that team to start calculating more overpayments to bring money back into the community and the county.
Do we bring that stuff up in conversation with folks as they're going through the system, making sure they understand that if there's a problem, they could end up in court or whatever?
We do. We really put a lot of time into what we call our front-end detection system.
Yeah.
The years I've been with the county, it's a lot harder to get money back than it is to try to not give it to them in the first place.
Right.
So when we're training our new staff, that's where we focus first, is our upfront eligibility, upfront front-end detection, and then the investigations we hopefully will minimize based on that. But those discussions are had at interview and if they're referred for offense.
Our Division of Mental Hygiene, although it is hosted by DSS, it's under our umbrella, it really is more of a standalone. It's different investors, different scopes of work, very targeted populations, and what Nicole Combsey does, and many of you work with Nicole, is to bring money in from the federal and state, work with her community services board, which is by statute needing to be there, be able to understand who's getting what, where our gaps are. They do a lot of community assessments, and then they are pretty much, the community services board kind of steers where that money should go. And we've been pretty lucky to be able to get more money to focus on addiction treatment, because that has been a huge impact in our communities, and for law enforcement, for all of us who serve special populations. And then, I did put in about DSS security officers, and I just, shout out to the Sheriff's Department. Most of our officers that are located right in the Mexico building are retired. And so they're very savvy. They know a lot of these folks. They can spot when someone is looking to move in and be a predator on a single mom and a young kid. They intervene, and they are just wonderful. And the incidence of very volatile behaviors, the incidences of problems in our building have increased significantly since the pandemic. But there is, I showed you where the annual report is for mental hygiene. They do their own annual report, so this is just a real quick overview. Adult and Family Services. So Sarah Finley is our Director of Services. She's going to go over some data. Was Sarah going to kind of look at the annual report?
Were you looking at what was in the annual report or just the
You
other?
want me to?
Whatever.
I can do a quick, because I know we've taken up a lot of time, but there's a lot of data. I'm just hitting the high points here. Hopefully, if you have any questions after a thorough read, you'll contact Mario. But elder abuse, it's unfortunate as people become more desperate, they prey more on elderly family, friends, neighbors. And although we've seen a decrease over the 5 years in open adult protective services cases, I think it's because we're doing really good when we initially receive a report, getting in there and quickly identifying what the problem is and just moving along so we don't have to open it up for ongoing. So we're pretty pleased with all of that. And we do a lot with representative payees, which is kind of our preventive services. So we've got 411 individuals who are unable to have stability in their life because of financial exploitation or an inability for them to manage their own finances. So that's a pretty heavy lift as well. But you get in between money and somebody, it takes a lot of calming, de-escalating. Our long-term care at home services, we're really thinking this is going to kind of explode, especially if Hochul's budget goes through and the governor removes a lot of money for long-term care Medicaid. Because that's the biggest expense of any Medicaid budget, is your nursing home expenses. And that cut, if you've seen anything in the local papers, Loretta is a huge provider in Onondaga County, and they're wondering whether they're going to survive it.
Right.
So I know.
You're saying small ones will be gone, right?
Yeah, I know my colleague at OFA has spoke out and had a beautiful letter to the editor about spending on our elderly population. Retired folks, soon to be me. Elderly and retired.
And it is wonderful when people can age at home
Yeah.
with the support of a personal care aide or, someone to help them. Not everybody's able to do that.
Mhm.
And we do sometimes run into couples that try to take care of each other and it's longer than they should. And that causes a lot of issues sometimes for them going forward.
We have gone over a lot of CPS data recently. It's back to pre-pandemic levels. And like all of our caseloads, what we see in those caseloads are so much more toxic. Just the past few months, how many removals again?
I don't have the exact number for March yet, but I think since the beginning of December, we've probably had close to 120 removals.
Removals, yeah. Kids removed. It's, we are having a very, very difficult time keeping up and having the legal services, enough attorneys to be preparing all these trials and trying to find foster homes.
Then
Are
there's
people, are there still foster parents out there? Yeah.
There is. You can see on page 17, actually, hold that thought, because I think that's on the foster care report. Isn't there data there about how many we have? And
Yes.
yeah. I'll tell you what's different, though, is the number of families, relatives, kinship care, who are willing to take a child if they're certified as a foster parent versus just taking custody in their own family, because they have our support. They have a buffer between them and the parents. Typically, they're parents who have addiction issues, mental health issues. So our Article 10 placements, our relative placements on page 17 continue to be pretty significant. And our preventive services. The problem with saying they're preventive services is we don't have the capacity to do much more than just what's court mandated. What we have a court order, we're not removing the kids, but you've got to do this, this, and this, or else you will end up losing your kids. And that's about 95%. Further investment, which means right now at least a 32% local share of those costs is highly, highly recommended. It's been recommended by CPAC, your Child Protective Advisory Council, by me. I've let you know, just before I came, the Board of Legislators removed $3 million in preventive monies for contracts. And often, I was a purchased preventive services caseworker in Onondaga County, worked for Salvation Army, for charities. Let me tell you, I got myself in that door a lot easier and quicker than when I said, I'm from Madison County as a child protective or child welfare professional. Government has become even more suspect since then. So I continue to hope and pray that perhaps with more monies coming in from Micron, the board would maybe look at like a 2% to prevent. 2% of the additional revenues we bring in are earmarked for prevention. It's a strategy that seems to have worked in other counties.
I hate to bring this up, but in light of what happened in Syracuse, do we have the ability to, if they find a child in a situation like that, the man was in that young child, is there a way for our group to, if the supervisor, can the supervisor bring up with other supervisors how to handle that? Or, because that seems, I don't know if that fell through the cracks for them or what their issue was with that died of the overdose. Do we have a fallback so that we don't get into that type of situation, or it's just one person or two people?
I'll repeat what I've said since the Hunter Freeze. We are a fragile organization. Our child welfare operations are still fragile. And the only way that you can really count on a child welfare organization is if you have experienced, well-trained caseworkers. And did we hear almost 70% of ours less than 2 years? That's not experienced.
Mm-hmm. But do we have a way for that team of two to bring this up with the other teams, just to say, hey, here's a situation we have? Any thoughts on where we should be going with it?
They're supposed to be carrying